Most people go to bed every night believing sleep is healing them. But what if the very position you sleep in is silently working against your body for 6, 7, even 8 hours straight? What if your exhaustion is not just stress? What if your morning stiffness is not just age? What if your bloated stomach, your tight chest, your dry mouth, your neck pain, your snoring, your acid reflux, and your constant fatigue all have one hidden trigger you've been repeating every single night for years? Because while you are asleep, your body is not off. Your body is under pressure. And the side you choose to sleep on can determine whether your organs are supported or compressed, whether your airway stays open or collapses, whether your spine relaxes or twists under tension, whether your stomach stays calm or pushes acid upward into your throat while you sleep. This is not comfort. This is anatomy, and anatomy does not care what feels familiar. It only responds to position. That means millions of people are lying down every night in a way that quietly increases strain on their heart, lungs, stomach, neck, jaw, and lower back, and then waking up wondering why they still feel broken. The truth is, some people are not waking up tired because they need more sleep. They are waking up tired because their body has been fighting gravity all night. And the side you sleep on may be one of the most overlooked health decisions you make every single day. Because when you lie flat on your back, your tongue and soft tissues can fall backward, narrowing the airway. That one collapse can turn a quiet night into a battle for oxygen. This is why so many people snore more when they sleep on their back. This is why some people wake up with a dry mouth, a sore throat, brain fog, headaches, and crushing fatigue even after spending enough hours in bed. They were asleep, but their body was not resting. It was struggling. Every time the airway narrows, the brain senses danger. The nervous system stays on alert. The body never fully lets go. And if that pattern repeats over and over through the night, the result is not recovery. It is wear and tear. Now think about how many people live like this for years without ever realizing the problem may begin with something as simple as the way they lie down. Then there's digestion. One of the most shocking things many people never hear is that your sleep position can influence whether stomach acid stays where it belongs or rises where it should never be. That burning in your chest, that sour taste in your mouth, that nighttime cough, that throat irritation in the morning, that heavy feeling after lying down, it may not just be something you ate. It may be the direction your body is facing while you sleep. Because your stomach is not positioned symmetrically inside your body. Its shape and placement matter. And when you sleep on the wrong side, gravity can work against you. For many people, sleeping on the left side may help keep acid lower and reduce nighttime reflux, while back sleeping, and in some cases, right side sleeping may allow symptoms to worsen. Think about that. You may be blaming your dinner when the real issue starts after your head hits the pillow. That means the same body can feel completely different by morning based on one change most people never think to make. And this is why health is so deceptive, because the damage does not always scream. Sometimes it whispers. Sometimes it shows up as "I just don't feel good in the morning." Sometimes it shows up as fatigue that coffee can't fix. Sometimes it shows up as a stiff neck, numb fingers, shoulder pain, jaw clenching, a swollen feeling in the face, or a chest that feels heavy for no clear reason. And people keep chasing pills, supplements, expensive mattresses, and miracle fixes, while ignoring the position their body is trapped in every night. Then comes the spine. And this is where the hidden damage gets even more dangerous. Because your spine is not designed to stay twisted. collapsed, or unsupported for hours at a time. If your body falls into a bad position while you sleep, your muscles do not get to truly release. Your joints do not fully decompress. Your tissues do not recover the way they should. Instead, certain muscles stay overactive. Certain nerves stay irritated. Certain discs stay under stress, and you wake up feeling like your body aged 10 years overnight. A lot of people think pain begins when they move, but in many cases, pain begins long before that. It begins in the stillness. It begins in the hours when your body is stuck in one bad position and cannot protect itself. That's why some people wake up with neck pain before they even get out of bed. That's why some people stand up and immediately feel tightness in the lower back. That's why some people feel one shoulder burning, one hip aching, one arm numb, or one side of the jaw locked and tense. The body is leaving clues, and those clues often point back to how you sleep. Now here's where it becomes powerful. Because one of the healthiest positions for many people is not complicated. It is simply side sleeping done correctly, not curled up and twisted, not collapsed and folded inward, but aligned, supported, stable. And for many people, especially those dealing with reflux, snoring, mild breathing issues, and poor sleep quality, the left side may offer an advantage the body can feel almost immediately. This is where sleep stops being passive. This is where it becomes therapeutic, because the right position can reduce airway collapse, support digestion, distribute pressure more evenly, take strain off the lower back, reduce pressure on the chest, and help the nervous system feel safe enough to finally let go. And that word matters, safe, because your body does not heal deeply when it feels under threat. If your airway is collapsing, if your neck is twisted, if your rib cage is compressed, if your stomach is pushing acid upward, if your jaw is clenched and your spine is rotating, your body is not receiving the signal of safety. It is surviving the night instead of restoring through it. And this is why some people are exhausted even when their lab tests look normal. This is why some people wake up more inflamed than they went to bed. This is why some people are doing everything right during the day but still feel awful in the morning. They are not failing. Their body is simply being placed in a position that makes healing harder. And once you understand that, everything changes. Because you stop asking, "Why am I so tired?" and you start asking, "What is my body experiencing while I sleep?" That question can change your health. That question can reveal the hidden stress your body has been carrying night after night after night. And here's the most powerful part of all. You can test this tonight. Tonight, before you close your eyes, you can choose to stop sleeping on autopilot. You can choose to place your body in a position that supports your airway instead of collapsing it, supports your stomach instead of aggravating it, supports your spine instead of twisting it, supports your recovery instead of sabotaging it. That means tonight is not just another night. It is an experiment in healing, and tomorrow morning will tell the truth. If you wake up with less heaviness in your chest, less burning in your throat, less stiffness in your back, less tightness in your neck, less fog in your head, then your body will have proven something most people never realize until far too late. The side you sleep on is not a small detail. It is a health decision, a silent one, a daily one. And for some people, it may be the difference between years of unexplained suffering and the first real step toward feeling better again. So before you sleep tonight, remember this. Your body is always listening to the position you place it in. Every hour, every minute, every night. And if you've been sleeping on the wrong side all this time, then changing that one habit, it may be one of the simplest, most powerful health corrections you ever make. Most people think bad sleep comes from one of three things: stress, age, or a bad mattress. And while those things matter, there is one invisible mistake that almost nobody talks about. A mistake so small it looks harmless, so ordinary it happens in millions of bedrooms every single night. And yet this one mistake can quietly twist your spine, compress your shoulders, strain your neck, irritate your nerves, tighten your jaw, and leave your body waking up more damaged than when it went to bed. That mistake is not always your sleeping position. It is often ***, what your body is missing while you sleep ***. Support, because sleep is not just about closing your eyes. Sleep is a mechanical event, and when your body is not supported correctly for 6 to 8 hours, your muscles don't truly relax. Your joints don't fully decompress. Your circulation doesn't flow as efficiently. Your nervous system doesn't fully settle. And the body that was supposed to recover through the night starts compensating instead. That is why so many people wake up saying the same thing. My sleep was long, but it didn't feel restorative. Because time in bed does not guarantee healing. Alignment does. And one of the biggest reasons people wake up with neck pain, shoulder pain, lower back stiffness, hip tension, numb hands, tingling arms, and morning headaches is because their body spent the entire night falling out of alignment in slow motion ***. The terrifying part is this: you usually never feel it happening. You don't feel the spine rotating 1 inch at a time. You don't feel the shoulder collapsing inward. You don't feel the top leg dragging the pelvis forward. You don't feel the neck being bent at the wrong angle for hours. You don't feel the pressure building until morning comes and suddenly your body feels like it has been punished in your sleep. And then you stretch, you rub your neck, you roll your shoulders, you sit up slowly, you tell yourself, I must have slept wrong. But what if sleeping wrong is not bad luck? What if it is a pattern you repeat every single night? Because the body does not just need rest. It needs ***, positioned rest ***. And this is where something as simple as a pillow becomes one of the most powerful health tools in your bedroom. Not because it is soft, not because it is expensive, but because the right support can stop your body from collapsing into pain while you sleep. The first place most people sabotage their sleep is at the knees and hips. This sounds small, but it changes everything. When you sleep on your side without support between your knees, the top leg often drops forward. That one movement looks harmless, but it rotates the pelvis, and when the pelvis rotates, the lower back follows. And when the lower back follows, the entire spine begins to twist. Now imagine that twist being held not for a few seconds, but for 6 or 7 straight hours. That is not rest. That is low-grade mechanical stress, night after night, month after month, year after year, and people wonder why they wake up stiff. Why one hip always feels tighter, why the lower back always feels jammed, why one side of the body never feels quite right. Sometimes the answer is not hidden in a scan. Sometimes it is hidden in the way the body falls apart after midnight. This is why placing a pillow between your knees is far more powerful than it looks. It is not a comfort trick. It is a structural correction. It helps keep the pelvis more level. It reduces rotational stress through the lumbar spine. It decreases tension through the hips and sacroiliac region. And for many people, it is the difference between waking up guarded and waking up loose. Think about how incredible that is. One pillow, one correction, one change in alignment, and your body may wake up feeling like it was finally protected instead of dragged through the night. But the knees are only the beginning. Now we go higher to the neck. And this is where some of the worst sleep damage happens in total silence. Because if your pillow is too high, your neck is forced upward for hours. If it is too low, your head collapses downward. Either way, your cervical spine is no longer neutral. And when the neck is not neutral, the body pays a price. Muscles tighten, joints compress, nerves become irritated, blood flow and tissue comfort can be affected. And by morning, what should have been a night of restoration turns into a warning sign. That warning sign often looks like a stiff neck, a tension headache, a sore jaw, a heavy head, a tingling hand, a burning shoulder blade, a strange tightness that no massage seems to fully erase. And people think they need stronger pain relief. But in many cases, what they really need is a better angle, a better setup, a pillow that actually fills the space between the ear and shoulder when lying on the side, helping the neck stay closer to neutral rather than bending all night. Clinical sleep guidance consistently emphasizes this basic alignment principle, along with support under the knees or between the legs to reduce spinal strain. Mayoclinic.org https://www.mayoclinic.org/diseases conditions/back pain/in-depth/sleeping positions/art 20,546,852 Atom source equals chat. Now let's talk about the shoulders, because this is where side sleepers often suffer without even realizing why. If your top arm has nowhere to go, it often falls forward, and when that arm falls forward, it drags the shoulder with it. That shoulder then pulls the chest inward, the upper spine rotates, the rib cage tightens, and suddenly the body is no longer resting in a balanced position. It is folding into itself. This is why so many people wake up with shoulder pain, upper back tension, numb fingers, and that deep ache between the shoulder blades that seems to come from nowhere. But it doesn't come from nowhere. It comes from *** hours of unsupported collapse ***. And this is why hugging a pillow can be such a powerful correction. Not because it is a comfort habit, because it supports the weight of the arm. It helps keep the shoulder from dropping too far forward. It can reduce chest collapse and rotational strain. And it gives the upper body a more stable position to relax into. That means one simple pillow can influence not just comfort, but mechanics. And mechanics become symptoms when they are ignored long enough. Then there's the nervous system, and this is the part almost nobody sees. Because when your body is twisted, compressed, or under low grade pressure all night, your nervous system doesn't fully interpret that as safety. Even if you stay asleep, even if you don't consciously wake up, your body still feels the tension. It still detects the pressure. It still responds to the strain. And that means you may sleep through the night, but never truly drop into the deepest quality of restoration your body is capable of. This is why support matters far beyond pain. Support changes how the body lets go, how the muscles release, how the breath settles, how deeply the nervous system can downshift, how fully the body can surrender into recovery. That is not luxury, that is biology, and once you understand that, your bedroom stops being just a place where you pass out from exhaustion. It becomes a place where healing either happens or gets interrupted. That is why the smallest sleep adjustments can create the biggest morning changes. Less neck tension, less hip pain, less lower back stiffness, less shoulder compression, less numbness, less jaw tightness, less tossing and turning, more ease, more release, more restoration. And the most shocking part is this: many people spend years chasing the wrong solution. They buy supplements, they blame stress, they change mattresses, they stretch every morning, they seek treatments for pain that keeps returning. And all along, their body is being pulled out of alignment by the exact same unsupported sleep pattern every night. No one told them the body remembers what happens in the dark. No one told them that tiny nightly misalignments become chronic morning symptoms. No one told them that healing often begins with what supports you when you are unconscious, but now you know. And that means tonight can be different. Tonight, before you fall asleep, you can stop letting your body collapse by accident. You can place a pillow between your knees. You can choose a pillow height that keeps your neck neutral. You can hug a pillow to support your top shoulder and arm. And in doing that, you are not just trying to sleep better. You are creating a structure your body can finally trust. A position it does not have to fight. A posture it does not have to compensate for. A setup that allows the spine to settle, the muscles to soften, and the nervous system to exhale. And tomorrow morning, your body will tell you the truth, not with words, but with what is missing: less pain, less stiffness, less pressure, less resistance. Because sometimes the most powerful health breakthrough does not come from doing something dramatic. Sometimes it comes from finally supporting the body in the places it has been silently struggling all along. And if you've been waking up tired, tight, aching, twisted, or unrested for longer than you want to admit, then maybe your body has not been asking for more sleep. Maybe it has been asking for more support.